this exchange.
Absolutely.
Extraordinary.
Yep.
Ms. Matsky, let me ask you something. So you provide health care to women free of charge, right? Is that right?
Absolutely.
You've done this for many years.
Yep.
You have licensed medical professionals at your pregnancy care centers. Is that right?
That is correct.
And what are some of the resources that you provide for women who come to you in a time of need?
So-
just give us you talked about it in your written testimony, but just give us a sense of it.
So we have 3 OBGYN doctors, 5 registered nurses, nurse practitioners, physician assistants, phlebotomists, medical assistants, and we provide prenatal care, OBGYN care. We provide pregnancy tests, ultrasounds, well woman visits, breast exams. We provide a wide range of medical services, yes.
So what do you think about the DC politicians now saying that your clinic and the other 3,000 pregnancy care centers around this country are fake medical clinics? For instance, Senator Warren has said it's now more important than ever to crack down on so-called crisis pregnancy centers that mislead and deceive patients. Senator Menendez, crisis pregnancy centers jeopardize women's health and well-being, all while elevating unproven theories about birth control. Senator Warner wrote to Google asking them to censor search results for care centers like yours, saying, directing women to fake clinics that traffic in misinformation is dangerous to women's health and undermines the integrity of Google's search results. Do you run a fake clinic? I mean, is that what's happening here? You don't provide actual medical care to actual women?
We absolutely do not run a fake clinic, and we have a full medical staff. Like I said, many of our medical professionals have experienced abortion for themselves, including our OBGYN doctor who used to perform abortions. So our entire medical staff is there for women, whether they choose abortion and walk out the door or whether they choose life for their baby, and we support them for years after that.
Do you think there ought to be an ideological test to be able to get medical care in this country? I mean, should we say to women, well, you have to agree with the DC Democrats' ideology, otherwise you can't go get medical care? Or maybe for you and the physicians who work at your pregnancy care center or the thousands of others across the country, should we impose an ideological test on them and say that, well, you have to agree with the DC Democrats' position on abortion or you can't provide medical care to women? Should we do that in this country?
Absolutely not.
I just want to ask in my few remaining seconds here, Ms. Hawley, the Dobbs decision, as I understand it, I've read it now a number of times, it gives to voters the decision as to what laws should be pertaining to life and pertaining to abortion in all 50 states and other jurisdictions around the country. I'm just curious, do you know what percentage of voters in this country support the DC Democrats' position that they want to impose on the entire country, a one-size-fits-all rule they want to impose from the top down? Do you know what percentage of voters support their position, which is also, by the way, the same position taken by North Korea and China, other notable violators of human rights? Do you know what percentage it is?
I know that nearly 90% of Americans oppose abortion in the 3rd trimester. The number that would support abortion up to the moment of birth has to be minuscule. It's a horrific policy.
Yeah, I mean, based on the most recent Harvard poll that was just released just a few days ago, less than 10% of voters say that they would support abortion into the final month of pregnancy, and yet that is the law that the DC politicians want to impose on every voter in America, to take this away from the people, take it away from my state, take it away from all the other states and the voters in the states, but impose this law uniformly that is not supported by 90% of the American people. Talk about anti-democratic. At the same time, they want to shut down 3,000 pregnancy care centers all around this country. That's radical. Thank you for being here.
Senator Padilla.
Thank you, Mr. Chair. Thank you all